fellow current and future healthcare leaders. Welcome to the Health Admin Life podcast. My name is Brooke, and today I would like to welcome Dave Tapia, healthcare management consultant. Dave, can you tell our listeners a little bit more about who you are?
Hi, thanks, Brooke, and appreciate you having me on your podcast. And yeah, my name's Dave Tapia. I'm a healthcare management consultant, 20 years in healthcare, and so just been evolving with my career and providing a lot of client support services to healthcare organizations around the country.
Wonderful. And I think listeners would love to know kind of where you are right now, what your position entails, maybe that day to day or high level view.
Sure, yeah. No, so as a healthcare management consultant, just sort of a high level, we go into healthcare organizations. We typically try to identify problem areas and conduct some, gap analyses and things like that that allow us to see where the client's goal is to be, whether it's in regulatory compliance or it's from a technology perspective. I happen to specialize in digital transformation strategy and post-acute care. So really kind of sitting at the intersection of those three. And so really just trying to help the clients get to where they would like to go in their journey in providing the delivery of healthcare.
Thank you. And I know your position, you mentioned that you're more of a healthcare consultant, but you also mentioned you're doing digital transformation and post-acute care. What sector of healthcare would this be considered?
So within the consulting sector, it happens to kind of sit and support mostly post-acute care. However, I've been on a project at Kaiser Permanente, and so that actually is an integrated healthcare system. So I have done a little bit of work on the health plan side. I've done a little bit of work, on the post-acute continuum side, and so from care delivery, that's probably the area that I'm sitting at now and supporting now is the healthcare delivery services. And so that's really focused on like throughput processes and also implementing. Right now, we're operationalizing CalAIM. That is a huge multi-trillion-dollar Medicaid expansion initiative in California. And so a lot of my work has been sitting taking healthcare policy and then operationalizing that. So from creating departments to policies and procedures, all the way to like nitty gritty workflows. So yeah, it's been fun.
Very cool. That's awesome and very different. I don't think a lot of people get to go into the policy side of it as much. So I'm very interested in learning more. But for my next question, how did you get to where you are and how long have you been in the industry?
Yeah, that's a great question because it's always good to kind of understand a person's journey, in their career and how they got there because there's no right or wrong way, I think, to navigate your career in healthcare management. So I started out as a case manager for adults with intellectual disabilities. So case manager of two group homes out in the community. I did really well, got zero deficiencies on state surveys for both of those homes through my tenure. And then I got promoted. So I was a director of sort of day habilitation center that was affiliated with this special population. And I was director at 26. And so I had people double my age that I had to lead on direct care staff teams and, really had to handle everything from budgeting to hiring to firing to like implementation of policy and, just really even like creating policies. And so like really trying to grow the organization as well. And so quickly, I found myself really in need of some more education and just some more growth. And so I went back for an MBA in healthcare management, and I got that here in San Antonio while working full time. After my healthcare management MBA, I went ahead and became an administrator at a home health and hospice organization here. So really, that was my foray into post-acute care. After that, left to join a couple of family members who opened up a consulting firm for home health and hospice agencies, and implemented EHR solutions, policy work, did some quality assurance and quality work as well. So auditing and things like that. But my foray into digital transformation really started with the EMR implementation, EHR implementation. So that grew and that just sustained for quite a while. And I opened up my own shop, had it for 13 years. It was a boutique consulting firm. And during the Great Resignation a couple of years ago, I put my resume out there and I had a lot of interest in sort of my post-acute digital transformation strategy skills. So I was able to hop along and find a tribe with Freed Associates, and that's a consulting firm that I'm with today. And so it's a great firm, great people, lots of learning. It's a blend between the academic aspect of healthcare management and then also applied healthcare management consulting techniques. So super interesting for me. So yeah, that's kind of my journey in a nutshell.
Thank you. And I think you mentioned this when we had talked before, but you also helped train, I think, 21 different hospitals and all virtually.
Yeah,
I'd love to learn a little bit more about that.
sure.
How did that even work? And was there any successful tips that you have to viewers
Mhm.
listening?
So that is a that's a great sort of story, if you will. So in my current project work, I've been with Kaiser Permanente as a client for about a year and a half. I'm actually going to roll off at the end of the month to new client work. But I was brought in to actually start a project for them, and it was really in building clinical decision-making tools to enhance hospital throughput. Be able to have sort of discharge disposition tools. And so we created these tools that allowed clinicians to be able to put the right patient at the right care setting at the right time. And so it was hospital throughput to post-acute care settings. And so that being said, we had a lot of design sessions. We had over 60 stakeholders, over 50 design sessions cumulatively, designed about 50, maybe actually more like 12 sets of tools that allowed us to implement and roll out to the 21 medical centers in the NCal region. And so those are the 21 hospitals that you're mentioning. We did a lot of alignment at first, and KP or Kaiser Permanente is hyper inclusive. And so what that means is when you first do an initiative, you have to get all your stakeholders at the table. And so you have champions, you have your executive sponsor, you have champions, and then you have like sort of your work group. And that's my work group was about 60 people. And so we would meet weekly, not all 60, but it would be in phases. So we had two phases for development of tools, and then we essentially were able to train these medical centers once we had approval of all the tools and we've tested them, things like that. So we had pilot site. So we had 3 hospitals volunteer as pilot sites. We did a 30-day sort of measurement period after sort of going live at those pilot sites, seeing how successful those tools were. After that, we rolled out to the rest of the 21 medical centers. And we did that by grouping the medical centers in about 5 different groups. And so we would find, we'd had about a quarter to be able to train all of the different medical centers. And so I did virtualized training. I've done that for years. Like I said, I've been rolling out EHRs probably closer to 15 years. And so we would use Zoom when it was like in its infancy. So some of the techniques that I would use were kind of having some interactive aspects to training. So, poll questions, exercises where you would have like sort of like repeat back, kind of things. And so we would have built into the curriculum some different engagement tools to allow the clinicians to be able to engage and not just sort of have a snooze fest of a training session. So also just keeping those training sessions short, actionable, recording them, of course, for posterity and future training as well. And then just being really energetic as a facilitator trainer. So like really having the personality, your voice says so much, I think, when you're training, clinicians. And so when you're trying to do that change management aspect and really getting the buy-in early on with their leaders, hospital leaders, really driving the buy-in as well. So there's a little bit of a blend of the change management and soft skills that is needed in consulting in order to affect change throughout a region or an organization.
I think that this is awesome. One, very familiar with change management. I do that a lot with my work. But I also think that your work and mine overlap, especially with the product management side of this, having to
Mhm.
roll out something, make sure that it's successful, then follow up and see if it actually worked, lessons
Mhm.
learned, XYZ. And it's never easy. And with 21 different hospitals and facilities, that is incredible. So very, very cool work. But going into my next question is, and I see you're already passionate about this. What is your favorite thing about healthcare, working in healthcare?
I think it's working with people. One of my like foundational sort of things that I rely on is my training as an anthropologist. So my undergraduate degree is in anthropology. I know I caught a lot of flack when I was at Texas A&M and I was pursuing anthropology. And so it's like, what are you going to do with that? But anthropology is the study of people, and so wherever there's people, it's applied. And so I practice a lot of the anthropological training and principles in my work, and I think that that has helped me to build an understanding of why people do the things they do. And in consulting, you're asking those same very questions. So, for example, I've done corporate ethnographies before, and what that does is it tells a story about the organization and where it's at. And we talk about like the different power dynamics and the different structural dynamics at play that affect the work. And so it's really applied anthropology in practice. And then, of course, I use my board certification in healthcare management, being a fellow at ACHE, my MBA, like that knowledge base also sort of helps to augment from a healthcare expertise perspective, like it augments the work and it augments that deliverable, so it supports that. But yeah, it's the people, and I love the people I work with. I made relationships for a very long time, and so very close with a lot of my clients and of course their staff as well.
Wonderful. Thank you for sharing. I do have a question with that. You mentioned the corporate something. What was that word that you use?
And
I've never
ethnography. When I was like studying anthropology, anthropologists are known for going into like a tribe or a society and documenting in an ethnographic format. And so what that does is you interview members of that society, of that tribe, of that culture, and you try to gain an understanding and you write that down in an ethnographic format. And it really explains a lot of things like cultural rituals, taboos, rites of passage, perhaps, power dynamics, organizational structure, so tribal structure, cultural structures, things like that, all these different mechanisms. And what I did was I was like, oh, this is something that I could take and repurpose. And of course, having my own boutique consulting firm, I could do that. And I could say, oh, I'm going to take that approach, qualified to do so, trained to do so, and take that to my clients. And I think that they found real value and real insights because as a third party, as an anthropologist, you're never part of the tribe. You're always sort of that viewer. And so it's the same thing in consulting. You're never part of that tribe, you're always
100%.
that external, like sort of like participant. But people do trust you. And so in that position of trust, you're able to learn about the organization and then able to explain why people do the things they do. So it all comes back to that one question, like why do people do the things they do? And you probably ask yourself that in healthcare all the time. I know anybody who's in healthcare, we all ask that of ourselves at times. And so it's important to take that sort of curious ethnographic approach.
Very cool. And I think this just demonstrates that you can have any background in healthcare. It honestly doesn't matter. I mean, there's some skills that will definitely help, but
Mhm.
all of the skills you can either learn on the job, the technical side, or
Mhm.
throughout your career, you can learn the EQ side.
Mhm.
But I think this is a great segue into the next question is, do you have any advice to young leaders, whether it's skills they need to build or even careers and degrees to get into certification
Mhm.
or even professional
Mhm.
organizations to join?
So that, yeah, I have a lot to share on that. And so what I'll try to do is succinctly just categorize areas where I think young careerists could, pursue or model after. And so I think that number one, you need to find your why. So why are you pursuing a career in healthcare management? What is it that motivates you? Is it the patient care side? Is it the transformational aspect? Is it quality? Some people really are interested in epidemiology or different aspects of healthcare. So kind of try to find what's your interest and then look at the technical skills that are required as well. Because in my world, for example, I recently got certified as a safe agilist practitioner. And so that is really, so that's really useful when it comes to the digital health side. But let's say you are in quality and let's say you'd like to pursue a career in quality or hospital administration. You're going to look at different certifications. I do know this that my affiliation with health with ACHE or American College of Healthcare Executives has actually, to me, been highly beneficial. It allows me to learn about healthcare management concepts. I was able to get the fellow designation, so I was able to become board certified in healthcare management. That really kind of buttresses and supports the expertise, right? When we talk about healthcare, leaders know that you know what you're talking about. But I do have to highlight this. I think that above all else, if you have some training in the softer skills, storytelling, communication, leadership, what's funny is the soft skills get a good bashing in the business world. But let me tell you, that's what people are hiring for. People can hire for the technical skill sets all day long. I was on a call yesterday with a data scientist, and he had absolutely zero uh, soft skills and EQ. I mean, it was really painful. So, if you'd like to accelerate and climb the career ladder and just be somebody who's a trusted healthcare management leader, you're going to want to really like build on those soft skills. And so I think leadership courses are great. I think that communication courses are awesome. And then the anthropologist comes back out in me and says storytelling. What's hilarious to me and like it's refreshing is that we're going back to the sort of the fireside storytelling techniques, and some of the greatest leaders that you're ever going to meet are actually, they may not have all the technical knowledge, but guess what, they know how to tell a darn good story. And so that's something that I feel like is not really talked about in our field. We are in a field where we have to tell the story, whether it's to internal stakeholders, external, patients, family, or just our general society about healthcare and the patient's journey or our clinicians' journeys. We're going to be in storytelling mode for a very long time. And that's an art that we won't lose as a society, but it's getting more rare. So it's going to be the healthcare leader of tomorrow is going to have a blend of the soft skills and of course the technical skills as well. And that could include familiarity with digital health and technologies like that.
Thank you for that
Mhm.
input. One, congratulations on the fellow, and I'm saying it wrong, please correct me, fellow ACHE. So it's the FACHE
Oh,
designation, which
all
is
right.
awesome.
Thank you.
Two, with the Agile certification, I
Oh, thank
actually
you.
have a similar story. I went through training last year, didn't actually take the exam. So I literally pulled it up this morning, which is so ironic to take the exam.
Awesome.
So we'll work on that over the weekend, but so cool. And then lastly, soft skills, going back to storytelling. More and
Mhm.
more, you have to be able to not only verbally tell a story, but also demonstrate it graphically, or
Mhm.
whether it's on PowerPoint or Word document. So your
Mhm.
writing skills, your design skills are
Mhm.
so, so vital. Um,
Mhm.
so I think it's great. I would agree. Storytelling is very important.
Mhm.
Um, well, thank you for that input. And then my one of my last questions, but not fully last is if there was one thing you could improve within the healthcare delivery system within the US, what would it be?
Wow. That's a tough question, but I think it would be broadening the level of access to healthcare. I think that we have, because of our healthcare financing mechanisms, we have vast underserved populations, and I feel like if you broaden access and make it available, and I know folks who are in healthcare management programs, you probably hear that all the time. I think there's no truer need than that in healthcare. And I think everything else falls into place. I think the financing of healthcare falls into place when our nation makes it a priority to provide healthcare to people all over the country, despite payer status and insurance, coverage and things like that. I think some massive reform needs to happen. It's underway. But it's very slow moving, as you can tell, because things in Washington kind of move a little slower for a myriad of reasons that we probably shouldn't get into today. But yeah, I think just broadening access, when you set your North Star and that's delivery of healthcare to all, then, like I said, I think you start to prioritize what needs to happen to support that.
Thank you. And something that you touched on access more specifically is the payer and the payer possibly mix and everything that goes into it. But
Hmm.
I also think financing is so important and so
It
crucial. And
is.
do you have anything to go off of that a little bit more?
Mhm.
Is there a
Mhm.
first step in combating the finances of healthcare?
Mhm. I do. I think that we can look to some of our friends in Canada. I think we can look to some of our friends in Western Europe. I think we can look to Singapore. We focus on these sort of universal healthcare models. And while they have their own downsides, I totally get, in those instances, sometimes yes, you have universal healthcare, but maybe you have long queues or waiting, lines and things like that. I think that if you look at Singapore and they have an intergenerational model of wellness, that's really, I think, where it's at. I think when we talk about access to care, we also have to include the prevention and the wellness aspect, which is so difficult, I think, for our society today because we have so much technology and we're very sedentary and our lifestyles are, commuter based. But if you look at like sort of the Singaporean, like, intergenerational models, I think they're astounding. And at some point, either we pay for it, like as you alluded to on the financing side, either we pay for it up front or we pay for it at the end. And I can tell you this, if we're not getting a good ROI right now, because I think it's like 16% or more of our GDP is spent on, our uninsured population. Like we're spending that money anyway, but what are we getting for it? We're not getting the outcomes that we need. And so the money's there to be spent. Imagine if we spent that 16% of our GDP up front. Oh my gosh, like who knows like what we could do. And I think we should broaden that to include nutrition. And I feel like, really encouraging just access to just better quality food, more organically, and just things that are more sustainable. Food deserts are a real thing, and they contribute to extreme health disparities. So
I could talk about this for hours,
I know.
but one, I actually haven't looked into the Singapore model. I've looked into the Canadian one, and like you said,
Mhm.
wait times might be longer. It's not a perfect
Mhm.
model. I don't
It's
think
not
anyone
perfect.
has a perfect model, but I don't think we've gotten it right. And I know, as we mentioned in the beginning of this, Washington moves slow, the government moves slow,
Mhm.
but at least I think we're moving towards the right direction where we're
Mhm.
increasing transparency laws when it comes to reimbursement
Mhm.
and costs of care. Um, but is it fast enough? I don't think so. I mean, even thinking personally, the amount I've had to spend, not only just for premiums or
Mhm.
copays, XYZ deductibles, but even just to go to my appointment, I have phantom billing, which people probably don't know. It's like costs that you don't actually know where they're coming from. You can ask for an itemized bill, but
Mhm.
you're still like, okay, where is this coming from? And I don't think
Mhm.
that's okay. And so hopefully in the future, things like this improve. And so I appreciate you speaking on this topic a little bit more.
Well, thank you.
Now, for our actual last question, and you can talk about it generally, you can talk about your company, XYZ, or don't
Mhm.
answer at all, but we love to ask more about salary transparency. Do you
Mhm.
have any salary ranges that you'd like to share
Mhm.
generally, or any advice to young leaders,
The so the salary ranges I'm happy to speak to
or about
because I think
negotiation,
oh, I'm sorry.
or about negotiation?
Well, both. Let's talk about both. I think I can do both. Because I happen to be passionate about, being able to have a young careerist go out in the marketplace and understand their worth, and negotiate fairly with an employer. So, uh, when you're first starting out, I think that it's important to take opportunities and employment opportunities where you feel like you could grow, right? And so try not to pigeonhole yourself. So I think that's part of like sort of the being really judicious about the different opportunities that are presented to you. And if you'd like to become a healthcare consultant, it does sound like glamorous and sounds awesome, and it is. There's also, it can be hard work. The firm that I happen to be at right now, actually, we hire more senior consultants, and so most consultants have about 20 years experience. They've proven themselves, so it's a little different. I can tell you right now, the salary range that they hire for is between it for an entry level bachelor's degree. It's like between like 160 and like 230. Those are Bay Area prices, and so salaries they will adjust for your market. So if you're a little bit more senior and you have a master's degree, you can kind of be up in those 200s pretty easily, I think. That's harder to find nowadays. But when you're trying to negotiate a salary, I think you have to look at it in a few different ways. It's like a multifaceted sort of view. A lot of people look at the salary first, which is obvious. That's natural, right? We want to look at like what are we going to get every 2 weeks or what have you. Um, but also look at the total benefit compensate, like sort of benefit package. Like, what did they do for you in terms of healthcare, dental, vision? Because there's a real tangible value there. That could be, $10,000 a year. We don't know. Do they do profit sharing? My firm does profit sharing. So to me, that really incentivizes all of us consultants. There's about 60 of us to work really hard and to deliver, highest, delivery excellence to our clients. And so that helps when you look at profit sharing and say, what do you historically do? Um, my firm does provide bonuses on top of that, which I think really helps to incentivize you. Like if you're working really hard and you happen to um, just just really kill it on a project, like they reward you, and I think that's amazing. Another thing is flexibility. Time is money, so if you look at that like the time value of money and you say I'm a full-time employee, let's say you are let's say you're like let's say you're expecting, right? And so in that instance you're going to value some time off. Does your firm allow you to go part-time? What do they have as far as like maternity leave or FMLA or what have you, like other benefits? And so in my instance, obviously not a woman, not expecting, but I would look at those things as
Paternal leave
well.
is also important too, though.
I think paternity leave is absolutely. And so my firm, while they don't offer like paternity leave, they allow us to flex. And so we could be hourly or salary based employees. We can also be part-time or full-time and still get paid, an amazing hourly rate. And so it just depends. Now, if your salary, that is, on the firm, and so they continue to float you in between projects. But if you're hourly, they actually give you a percentage increase on top of that because they are not on the hook, so to speak, for if there's a lull in the different engagements. And so typically, our consultants can do either. And so I know quite a few consultants that are actually part time. They work 20 to 30 hours a week, depending. They still make a great hourly rate, but they have their work-life balance. And a lot of these are working moms. This is we're actually a woman founded and led organization, and we've won awards for that. And so I feel like I'm really proud of my firm. I'm really proud of Dava Freed, who is the founder and CEO, and she's, in her early 70s, and she's still leading this thing, and it's amazing. So she's built a great culture. So
That's
yeah.
fantastic.
So
Um,
looking for a tribal fit as well, I think is important. So cultural
Wonderful.
fit.
And I think that it is important to not only, like you said, look at the base salary, but all the other benefits that come along with it, like healthcare
Hmm.
bonuses, and that's retention bonuses, sign-on bonuses,
Hmm.
bonuses, commission, XYZ, like even
Hmm.
401k matching, all of it.
Oh,
It's so
absolutely.
work-life
Hmm.
balance. If you want to work a 4-day week or
Hmm.
the hourly, I've actually never heard of the hourly work option before. So that's a really cool model to look
It's
into.
amazing. Yeah.
But on that note, before wrapping things up, I do want to just thank you so much, Dave. And it's been wonderful having you on the show as a guest speaker. Is there a way for listeners to connect with you post show?
Absolutely. I'm on LinkedIn, and so you can find me if you search Dave Tapia or David Tapia. I also have a website, davetapia.com, and so where you can actually book some time, and I provide career advice, advice about navigating salary negotiations and different job opportunities, things like that. That's always free, and so happy to just assist and help people along with their journey, because I certainly know that building my healthcare management career was daunting, and I did it myself. I would have loved to have somebody who I can lean on and ask questions. So I want to be of service to folks, especially young careerists, mid careerists, or if you're transitioning from one career to the other. I've helped folks in that mid career transition point. So, yeah, happy to be of service.
Well, on that note, I want to thank everyone for listening. This show is brought to you by our sponsors, Riverside and Spotify for podcasters. To listen to more episodes, check out the link in my bio at Health Admin Life on TikTok, Instagram, or YouTube.